Hello, my name is Cheyenne and I'm going to be performing tracheostomy suctioning video. So before anything, I would verify my physician's orders and gather my supplies. We have our suction kit right here and I have my sterile water right here. We would obviously introduce ourselves, identify our patient, and wash our hands. For demonstration purposes, this is my oxygenation tool. So we're just going to imagine. All right. So then we're going to place the patient in semi-Fowler's or Fowler's position unless contraindicated. And we're going to turn the suctioning on into the appropriate setting and making sure it works properly before we ever put our sterile gloves on, just to already have that kind of set up. We're gonna wash our hands again, and then we would don a splash mask and gown. I just used my gown for my previous checkoff, so we're just gonna imagine that I have a splash mask on and a gown, and I have washed my hands. So then we're going to open our sterile kit here. Make sure you can see me. Okay. Put my sterile gloves on. Okay, sorry, my cat's over here, so excuse if you can hear him. And we're gonna don our sterile gloves. These are a little small. I'm trying to get my fingers, this pinky one is not wanting to, there we go. So, they're a little small for me. I would have got my own set. Lord have mercy, doesn't want to leave. Okay, so then we have our sterile box. Put our saline in. It would sit up straight. There we go. Okay, and then we would have, let's see, this is our little suctioning. I'm gonna leave it in here for a second. We're going to take our non-dominant hand, and it's no longer sterile. Pour our sterile water in here, and I'm just going to set that to the side. This is no longer sterile. And we're going to, let's see. Sorry. Okay. Those steps 8 through 10 kind of confuse me a little bit, but this is non-dominant hand. I'm going to take this catheter and I'm just going to kind of wrap it up in my sterile hand. Basically what those steps are saying is to keep one hand sterile, your non-dominant hand not sterile. So we're going to hyperoxygenate our patient and tell them to take 3 to 6 deep breaths using manual resuscitation, or this little thing we're using right here, for several minutes. And we're going to remove this with our non-dominant hand. Okay, and then we're going to, you know, we would have checked to make sure that this is suctioning properly on the suction, connected to suction. And then we're going to insert this in, not suctioning. Okay. And since this is non-dominant, I'm just gonna, or non-sterile, I'm gonna hold outside so I can be able to put this in. And advance 5 to 6 inches or until the patient coughs. Like I said, not applying suctioning while inserting the catheter. And then we're gonna apply intermittent suction. My suction is actually right here. Intermittent suction right here. And we're gonna do that while rotating the catheter with our thumb and forefinger. And as catheter is being withdrawn, you'll do that intermittent suction, and you do not suction for more than 10 seconds. You also do not go any more than 3 rounds of doing this. We're obviously going to encourage the patient to cough and deep breathe during and assess if any further suction needs to be done. Like I said, you cannot do this for more than 3 flows back and forth of doing that. And we're always in between if we do need to do multiple rounds of suctioning to flush the catheter with the sterile saline and repeat as necessary. Replace your oxygen on the patient and allow the patient to rest at least 1 minute before suctioning. Excuse me, I did not mean to burp on here. And then we would replace the O2 source as ordered, turn off the suction, and discard of our supplies. We would then remove our gloves, wash our hands, auscultate the lung sounds, and document procedure, including the amount of secretions, characteristics, and respirations before and after suctioning. And actually, now that I'm thinking about it, within these steps, it did not say to listen to the lung sounds before starting, but we're just gonna say we did, and that way you have a comparison before and after. And then we would wash our hands. Thank you.